Body odor can be an early warning sign of cancer. Many people overlook unusual body odor, but it can be an early sign of cancer. As cancer develops, it can affect metabolism, producing specific chemical compounds that alter breath, sweat, and urine odor. Some studies show that trained dogs can detect these changes with high accuracy. Currently, scientific devices are being developed to analyze these compounds, aiding in early cancer detection. Here are some distinct odors that may be linked to different types of cancer. 1. Sweet, fermented fruit-like odor, lung cancer. Caused by the accumulation of volatile organic compounds in the lungs. Does not disappear after oral hygiene and may be accompanied by a persistent cough and difficulty breathing. Lung cancer is one of the most prevalent and deadliest forms of cancer worldwide. One of the lesser-known but potentially significant early warning signs of lung cancer is an unusual change in body odor, particularly a sweet, fermented fruit-like scent. This phenomenon is believed to be caused by the accumulation of volatile organic compounds (VOCs) in the lungs. Understanding the underlying mechanisms of this occurrence, along with real-life implications, requires an in-depth examination of human metabolism, cancer pathology, and how certain diseases can alter biochemical processes within the body. The human body continuously undergoes metabolic processes that result in the production of various chemical compounds. In healthy individuals, these compounds are typically excreted through breath, sweat, urine, and other bodily fluids in relatively stable compositions. However, when cancer develops, particularly lung cancer, the metabolic pathways of affected cells become significantly altered. Tumor cells tend to have a much higher metabolic rate than normal cells due to their rapid and uncontrolled division. This altered metabolism leads to the production of atypical chemical compounds, some of which manifest as detectable odors. Volatile organic compounds (VOCs) are a diverse group of carbon-based molecules that easily vaporize at room temperature. They are naturally produced by the body, but their composition and concentration can change in the presence of disease. In lung cancer patients, specific VOCs such as alkanes, benzene derivatives, aldehydes, and ketones are found in higher concentrations in exhaled breath. These compounds are byproducts of oxidative stress, lipid peroxidation, and abnormal cellular metabolism occurring within cancerous tissues. One of the key metabolic disruptions in lung cancer involves oxidative stress. Cancer cells generate excessive reactive oxygen species (ROS), which lead to lipid peroxidation, the breakdown of cell membrane lipids. This process results in the formation of aldehydes such as formaldehyde, acetaldehyde, and melondialdehyde. These compounds contribute to the characteristic fruity or sweet smell that some lung cancer patients exhibit. The reason this odor is often compared to fermented fruit is due to the similarity of these aldehydes to those produced by yeast during fermentation processes. Acetone, another metabolic byproduct frequently found in cancer patients, also has a distinctive sweet aroma and further contributes to this unique scent. Unlike odors caused by dietary factors or poor oral hygiene, the sweet, fermented smell associated with lung cancer persists despite regular dental care, mouth rinses, and hygiene practices. This is because the root cause of the odor lies within the lungs and the metabolic processes occurring at a cellular level rather than in the mouth or digestive tract. As air is expelled from the lungs, it carries with it the chemical signature of the disease, making breath analysis a potentially powerful tool for early detection. In addition to metabolic changes, another important factor influencing body odor in lung cancer patients is the presence of bacterial activity in the lungs. The respiratory tract contains a microbiome, a collection of bacteria, fungi, and other microorganisms that play a role in maintaining lung health. When cancer develops, the immune system becomes compromised, leading to an imbalance in this microbiome. Certain bacterial species that thrive in low-oxygen environments, such as those found in necrotic cancerous tissues, can contribute to the production of foul-smelling VOX. For example, some anaerobic bacteria produce ethanol and other fermentation byproducts, further enhancing the sweet, fermented odor. Clinical studies have explored the potential of using breath analysis as a non-invasive diagnostic tool for lung cancer. Researchers have found that trained detection dogs, which have an extraordinary sense of smell, can distinguish the breath of lung cancer patients from healthy individuals with high accuracy. This suggests that specific VOC profiles exist for different types of cancers, and technological advancements are being made to develop electronic noses capable of identifying these markers. By analyzing breath samples, medical professionals may be able to detect lung cancer at an earlier stage, improving the likelihood of successful treatment. To illustrate how this phenomenon manifests in real-life scenarios, consider the case of a 58-year-old man who had been experiencing persistent coughing and mild shortness of breath for several months. Initially attributing these symptoms to seasonal allergies, he did not seek medical attention. However, his wife noticed that his breath had developed an unusual sweet, almost fruity smell, reminiscent of overripe apples. Despite regular oral hygiene, the odor persisted. Concerned, he visited a physician, who ordered a series of tests, including a chest X-ray and a CT scan. The imaging revealed a suspicious mass in his right lung, and further biopsy confirmed a diagnosis of early-stage non-small cell lung cancer. This case highlights the potential importance of recognizing changes in body odor as an early warning sign and seeking medical evaluation promptly. Another compelling example involves a middle-aged woman who worked as a pastry chef. She had always been highly attuned to scents due to her profession. Over time, she began to notice a strange, syrupy aroma in her own breath, akin to fermented fruit. Initially dismissing it as an oddity, she later started experiencing episodes of wheezing and fatigue. A visit to her doctor revealed elevated levels of VOX in her breath analysis, prompting further diagnostic imaging. She was ultimately diagnosed with adenocarcinoma of the lung. Had she ignored the unusual odor, her cancer may have progressed unnoticed for a longer period, reducing her chances of successful treatment. In addition to exhaled breath, VOX can also influence other bodily odors. For instance, sweat composition can change in lung cancer patients due to the systemic effects of the disease. The metabolic byproducts released by tumors can be excreted through the skin, leading to a mild yet distinctive scent. Some cancer patients report that their skin smells subtly different, even when using the same hygiene products as before. This reinforces the idea that systemic metabolic changes can manifest in ways that are perceptible through olfaction. Furthermore, the connection between body odor and disease has historical precedence. In ancient medical traditions, physicians often relied on the sense of smell to diagnose illnesses. Traditional Chinese medicine, for example, describes specific odor characteristics associated with different organ imbalances. Similarly, Hippocratic medicine emphasized the importance of observing changes in body scent as part of the diagnostic process. While modern medicine has shifted towards laboratory-based diagnostics, the fundamental principle remains relevant. Biochemical changes within the body can produce detectable external signs, including odors. The presence of a sweet, fermented odor in lung cancer is also distinct from other medical conditions that alter body scent. For example, diabetic ketoacidosis (DKA) can produce a fruity breath odor due to excessive ketone production, but it is typically accompanied by severe symptoms such as confusion, nausea, and extreme thirst. Liver disease can cause a musty or ammonia-like smell due to impaired detoxification processes, whereas kidney failure may result in a fishy or uremic odor. Recognizing the specific olfactory signature of lung cancer requires careful consideration of accompanying symptoms and risk factors. While the detection of an unusual body odor alone is not sufficient for a definitive diagnosis, it serves as a potential red flag that should prompt further medical investigation. Individuals who notice persistent changes in their breath or body scent, especially in conjunction with respiratory symptoms such as chronic coughing, wheezing, or unexplained weight loss, should seek medical evaluation. Early detection remains one of the most critical factors in improving lung cancer survival rates, and awareness of subtle physiological changes can play a crucial role in catching the disease in its initial stages. The development of advanced breath analysis technologies holds promise for transforming cancer detection methods. Researchers are actively working on refining gas chromatography mass spectrometry (GCMS) techniques and biosensor-based e-nose devices to enhance the sensitivity and specificity of breath-based diagnostics. These innovations have the potential to complement traditional imaging and biopsy techniques, offering a non-invasive, rapid, and cost-effective screening tool for lung cancer and other diseases characterized by VOC alterations. In conclusion, the presence of a sweet, fermented fruit-like odor in lung cancer patients is a fascinating yet underappreciated phenomenon. This distinct scent arises from metabolic disruptions, oxidative stress, and bacterial activity within the lungs, leading to the release of specific volatile organic compounds. While not a definitive diagnostic marker, the recognition of unusual body odors can serve as an important early warning sign, prompting further medical evaluation. Ongoing research into breath analysis and olfactory diagnostics may revolutionize the way we detect and monitor lung cancer, ultimately improving patient outcomes through earlier intervention. 2. Metallic odor, blood cancers, leukemia, lymphoma. Due to changes in iron levels and blood chemistry, producing a scent similar to rusted iron or old copper coins. May be accompanied by fatigue, persistent fever, and unexplained weight loss. The presence of a metallic odor in individuals suffering from blood cancers such as leukemia and lymphoma is a phenomenon that has garnered increasing attention in both clinical and research settings. This distinct scent, often described as resembling rusted iron or old copper coins, is closely associated with alterations in blood chemistry and iron metabolism. To understand the origins and implications of this odor, it is necessary to delve into the physiological mechanisms underlying blood cancers, the metabolic changes they induce, and how these changes translate into detectable olfactory signals. Leukemia and lymphoma are malignancies that affect different components of the hematopoietic system. Leukemia primarily involves the abnormal proliferation of white blood cells, while lymphoma originates from lymphoid tissues and disrupts normal immune function. Both diseases lead to profound systemic changes, including disruptions in iron homeostasis and oxidative stress, which contribute to the emergence of a metallic odor. One of the key mechanisms responsible for this scent is the alteration of iron metabolism. Iron plays a fundamental role in hemoglobin synthesis, oxygen transport, and various enzymatic processes. In leukemia and lymphoma, iron levels can become dysregulated due to excessive breakdown of red blood cells, ineffective erythropoiesis, and increased demand from rapidly proliferating cancerous cells. This dysregulation results in the release of free iron into the bloodstream, where it undergoes oxidation and interacts with proteins and lipids. The oxidation of iron produces iron oxide derivatives, which contribute to the characteristic metallic odor. Patients with advanced blood cancers often exhibit signs of iron overload, further exacerbating these chemical reactions and making the odor more pronounced. Beyond iron oxidation, blood cancers also induce metabolic disturbances that alter the composition of volatile organic compounds (VOCs) excreted through the skin, breath, and bodily fluids. VOCs are small molecules that readily vaporize and contribute to bodily odors. In leukemia and lymphoma, increased cell turnover and oxidative stress lead to the production of reactive oxygen species (ROS) which accelerate lipid peroxidation. This process breaks down cell membrane lipids into aldehydes and ketones, which mix with oxidized iron compounds to produce a discernible metallic scent. Studies have shown that cancer patients exhibit unique VOC profiles, which may have potential applications in non-invasive cancer screening and early diagnosis. In addition to metabolic changes, systemic inflammation plays a significant role in the development of a metallic odor. Blood cancers trigger an immune response that results in chronic inflammation, characterized by the release of pro-inflammatory cytokines such as tumor necrosis factor alpha (TNF-alpha), interleukin-6 (IL-6), and interleukin-1 beta (IL-1 beta). These cytokines promote increased vascular permeability and the breakdown of cellular components, releasing metabolic byproducts into circulation. The interaction of these byproducts with iron and oxidized lipids amplifies the metallic scent. Patients often report that the odor becomes more noticeable during episodes of fever or increased inflammation, indicating a correlation between disease activity and olfactory changes. Another factor contributing to the metallic odor is the impact of chemotherapy and other cancer treatments. Many leukemia and lymphoma patients undergo aggressive chemotherapy, which affects rapidly dividing cells, including those in the bone marrow, gastrointestinal tract, and skin. As cells undergo apoptosis in response to treatment, they release intracellular contents, including iron-containing heme molecules and sulfur compounds. These molecules further interact with oxidative stress pathways, generating additional VOCs. Patients undergoing chemotherapy often report alterations in their body odor, with a stronger metallic quality being a common complaint. This is particularly evident during periods of high cellular turnover when large numbers of cancer cells and normal hematopoietic cells are being destroyed and replaced. Fatigue, another common symptom of leukemia and lymphoma, is also linked to metabolic dysfunction and changes in odor. Cancer-related fatigue is often driven by mitochondrial dysfunction and systemic inflammation, leading to increased lactate production and altered energy metabolism. The accumulation of metabolic byproducts in tissues and bodily fluids can influence body odor, with the metallic component becoming more prominent as the disease progresses. Additionally, patients experiencing severe fatigue may have reduced personal hygiene practices, allowing the accumulation of VOCs on the skin and in clothing, further intensifying the odor. Persistent fever, a hallmark of blood cancers, contributes to the metallic odor through increased sweating and changes in thermoregulation. Fevers are part of the body's response to cancer-related infections and inflammation. As body temperature rises, sweating increases, facilitating the release of waste products through the skin. This sweat carries iron-containing molecules, oxidized lipids, and metabolic byproducts, which, upon evaporation, produce the characteristic scent. Unlike the transient odors associated with common fevers, the metallic scent in blood cancer patients is often persistent, reflecting the chronic nature of the underlying disease. Unexplained weight loss, another frequent symptom, is linked to cachexia, a metabolic syndrome characterized by muscle wasting, altered energy balance, and systemic inflammation. Cachexia results in the breakdown of muscle proteins and fatty acids, increasing the production of ketones and other volatile metabolites. These compounds interact with the iron-induced oxidation pathways, modifying the overall odor profile of affected individuals. The metallic odor, in this context, may serve as an olfactory marker of advanced disease progression and catabolic metabolism. The presence of a metallic odor in blood cancer patients also has psychological and social implications. Many individuals become self-conscious about changes in their body odor, leading to anxiety and social withdrawal. Some report that family members or close friends notice the scent before they do, prompting concerns about their health. The ability of the human nose to detect subtle changes in body odor suggests that olfactory cues could be leveraged as an early warning sign for disease detection. In some cases, caregivers and healthcare providers have noted metallic or unusual scents in patients prior to formal diagnosis, highlighting the potential diagnostic value of odor perception. Recent advances in medical research have explored the possibility of using electronic noses (e-noses) and trained scent detection animals to identify cancer-related odors. These technologies analyze VOC patterns in breath, sweat, and urine to detect disease-specific olfactory signatures. In the case of blood cancers, researchers have identified distinct VOC biomarkers associated with altered iron metabolism and oxidative stress. While still in the experimental stage, these findings suggest that odor analysis could complement traditional diagnostic methods, providing a non-invasive tool for early cancer detection. From a clinical perspective, recognizing the significance of a metallic odor in leukemia and lymphoma patients can aid in symptom assessment and disease monitoring. Physicians should consider patient-reported changes in body odor as part of a comprehensive evaluation, especially when accompanied by other hallmark symptoms such as persistent fever, fatigue, and weight loss. Encouraging patients to report olfactory changes may facilitate earlier intervention and improve quality of life by addressing underlying metabolic disturbances through targeted treatments. In conclusion, the metallic odor associated with blood cancers such as leukemia and lymphoma is a multifaceted phenomenon driven by iron dysregulation, oxidative stress, systemic inflammation, and metabolic imbalances. The interaction of these factors results in the release of volatile compounds that produce the distinct scent described by patients and caregivers. Understanding the biochemical and physiological mechanisms behind this odor not only enhances our knowledge of cancer pathophysiology but also opens the door to potential diagnostic applications. As research continues to uncover the connections between metabolism, disease progression, and olfactory biomarkers, the role of scent-based diagnostics in oncology may become increasingly significant. 3. Ammonia-like odor, kidney cancer. Caused by reduced kidney filtration function, leading to urea buildup in the body, resulting in a strong, pungent urine odor. May also include back pain, blood in urine, and weight loss. The presence of an ammonia-like odor in individuals with kidney cancer is a clinical manifestation that arises due to the compromised filtration capacity of the kidneys. Under normal physiological conditions, the kidney's function is a primary organ of detoxification, filtering waste products, excess ions, and metabolic byproducts from the bloodstream and excreting them in the urine. However, in cases of kidney cancer, these essential processes become severely disrupted, leading to the accumulation of nitrogenous waste products, particularly urea, in the body. When urea breaks down, it releases ammonia, which then permeates bodily secretions, exhaled breath, and even sweat, contributing to a persistent and unpleasant odor. Renal cell carcinoma, the most common form of kidney cancer, gradually impairs nephron function. Nephrons, the microscopic filtering units within the kidneys, play a critical role in waste elimination. When tumor growth compromises their efficiency, the body is unable to adequately clear urea and other nitrogenous compounds from circulation. As a result, a condition known as uremia develops, in which toxic levels of waste accumulate in the bloodstream. One of the hallmark consequences of uremia is the release of ammonia as a metabolic byproduct, which explains the distinct ammonia-like scent often detected in patients suffering from advanced renal malignancies. This odor is often described as sharp and pungent, resembling the smell of concentrated urine or ammonia-based cleaning products. It becomes particularly noticeable when urea levels rise significantly, a state that often coincides with other symptoms of kidney dysfunction, such as fatigue, swelling in the lower extremities, and persistent nausea. The severity of the odor often correlates with the degree of kidney impairment. In the early stages of kidney cancer, it may be faint or intermittent, while in advanced stages, it can become more pronounced and persistent. The pathophysiology underlying this phenomenon can be attributed to the breakdown of proteins and the failure of the kidneys to excrete metabolic waste efficiently. When proteins are metabolized, they generate nitrogen-containing compounds, which are normally processed and eliminated by healthy kidneys. However, in kidney cancer patients, compromised renal function leads to the buildup of these compounds, particularly urea. As urea decomposes, it releases ammonia, which then escapes through sweat glands and respiratory pathways, contributing to the characteristic odor. This process is further exacerbated when kidney function declines to the point where dialysis becomes necessary to manually remove waste products from the bloodstream. In clinical practice, the ammonia-like odor associated with kidney cancer can be an early warning sign of declining renal function, even before more overt symptoms such as hematuria, blood in the urine, or flank pain become evident. It is not uncommon for patients to report an unusual metallic or chemical-like taste in their mouth, which is often accompanied by persistent dry mouth and a sense of nausea. These symptoms arise due to the interaction between elevated blood urea nitrogen (BUN) levels and oral mucosal receptors, leading to altered taste perception and a condition known as uremic fetor. Beyond its direct physiological causes, the presence of an ammonia-like odor can have significant psychosocial and emotional effects on patients. Individuals who experience this odor may suffer from heightened anxiety and embarrassment, as the smell can be persistent and difficult to mask with traditional hygiene practices. This can lead to social withdrawal, depression, and a diminished quality of life. Additionally, caregivers and family members may also notice the odor, further reinforcing concerns about the severity of the patient's condition. From a diagnostic standpoint, the detection of an ammonia-like odor in a patient with suspected kidney dysfunction warrants immediate medical evaluation. Blood tests, including serum creatinine and BUN measurements, provide quantitative insights into renal function, while imaging studies such as CT scans or MRIs can help visualize structural abnormalities in the kidneys. Additionally, urinalysis may reveal proteinuria, excess protein in urine, hematuria, or the presence of abnormal cellular casts, all of which are indicative of renal pathology. In cases where kidney cancer is confirmed, treatment strategies often involve surgical resection, targeted therapy, or immunotherapy, depending on the stage of the disease. Nephrectomy, or the surgical removal of the affected kidney, remains the primary treatment for localized renal tumors. However, in metastatic cases, systemic therapies aimed at inhibiting tumor growth and reducing symptom burden become necessary. Regardless of the chosen treatment modality, addressing the underlying metabolic imbalances responsible for the ammonia-like odor is crucial in improving patient comfort and overall well-being. Dietary modifications can play a supportive role in mitigating the severity of this odor. Patients with kidney cancer or chronic kidney disease are often advised to adopt a low-protein diet to reduce the metabolic burden on their impaired kidneys. By limiting protein intake, the production of nitrogenous waste products is minimized, thereby decreasing the amount of urea that ultimately breaks down into ammonia. Furthermore, maintaining adequate hydration is essential, as increased fluid intake can help dilute urinary waste and facilitate its excretion, thereby reducing the intensity of the ammonia-like odor. In addition to conventional treatments, some complementary approaches have been explored to help alleviate the symptoms associated with renal dysfunction. Activated charcoal and certain probiotic formulations have been investigated for their potential ability to bind to uremic toxins in the gut, thereby reducing their systemic absorption and subsequent contribution to the ammonia-like odor. However, these approaches should always be pursued under the guidance of a healthcare provider to ensure safety and efficacy. As kidney cancer progresses, the impact of uremic toxins extends beyond olfactory manifestations. Patients may experience a range of systemic symptoms, including persistent itching, uremic pruritus, cognitive changes, uremic encephalopathy, and severe electrolyte imbalances. These complications highlight the far-reaching effects of impaired renal function and underscore the importance of early detection and intervention. By recognizing subtle signs such as the presence of an ammonia-like odor, healthcare providers can expedite diagnostic evaluations and initiate timely treatments that may improve outcomes for affected individuals. Given the intricate interplay between renal physiology and metabolic waste processing, ongoing research continues to explore novel therapeutic approaches aimed at preserving kidney function and mitigating associated symptoms. The development of targeted drugs that modulate metabolic pathways, along with advances in renal replacement therapies, holds promise for improving the quality of life for kidney cancer patients. Furthermore, emerging diagnostic tools, such as metabolomic profiling and breath analysis, may offer non-invasive methods for detecting early metabolic changes indicative of renal malignancies, potentially allowing for earlier and more effective interventions. Ultimately, the presence of an ammonia-like odor in individuals with kidney cancer serves as a valuable clinical indicator of underlying metabolic disturbances. While it may not be a definitive diagnostic marker on its own, its recognition within the broader context of renal dysfunction can prompt timely medical evaluations and interventions. By understanding the biochemical and physiological mechanisms that contribute to this odor, healthcare providers can develop more effective management strategies to address both the underlying disease and its associated symptoms, thereby improving patient outcomes and quality of life. 4. Rotting meat odor, skin cancer, melanoma. As cancerous cells decay, they release compounds with a putrid smell. Often occurs in open wounds or non-healing skin lesions. Skin cancer, particularly melanoma, is a malignancy that arises from the uncontrolled growth of melanocytes, the pigment-producing cells of the skin. One of the less commonly discussed but clinically significant manifestations of advanced melanoma is the presence of a distinct, foul odor reminiscent of rotting meat. This phenomenon is largely attributed to the biochemical processes occurring within necrotic cancerous tissue and the metabolic byproducts released as malignant cells undergo rapid proliferation, invasion, and subsequent decay. The decomposition of cancerous tissue occurs due to several factors. As melanoma advances, the tumor often outgrows its blood supply, leading to ischemia and hypoxia within the affected region. This insufficient oxygenation causes cellular death, or necrosis, which results in the breakdown of proteins and lipids. The degradation of these biomolecules releases volatile organic compounds, VOX, including putrescine and cadaverine, which are responsible for the distinctive odor associated with decaying flesh. These amines are also commonly found in decomposing animal tissue, which is why the smell is often likened to rotting meat. In cases where melanoma progresses to ulceration, the presence of open wounds further exacerbates the release of malodorous compounds. These non-healing skin lesions create an environment conducive to bacterial colonization and infection. Bacteria such as Pseudomonas aeruginosa, Staphylococcus aureus, and anaerobic Clostridium species thrive in necrotic tissue, producing additional foul-smelling compounds like sulfur-containing gases and ammonia. The combination of microbial metabolism and cellular necrosis intensifies the putrid odor, which can be a distressing symptom for both patients and caregivers. The correlation between necrotic tissue and its olfactory signature is well documented in various cancers, but it is particularly notable in melanoma due to the nature of skin lesions being directly exposed to air. Unlike internal malignancies, which may exhibit necrosis without obvious external signs, skin cancer lesions that ulcerate and necrotize produce a persistent and unmistakable scent. Patients experiencing this symptom often report that traditional wound care techniques, including frequent dressing changes and the application of antimicrobial agents, provide only temporary relief from the odor. In addition to its diagnostic implications, the presence of a putrid smell in melanoma can significantly impact a patient's quality of life. The psychological burden of living with a persistent, unpleasant odor can lead to social isolation, embarrassment, and depression. Patients may feel self-conscious about their condition, avoiding public spaces or interactions with loved ones. Caregivers and medical professionals must address not only the physical symptoms of melanoma but also the emotional distress associated with these olfactory manifestations. Clinically, the detection of a rotting meat odor in a patient with suspicious skin lesions should prompt immediate medical evaluation. While early-stage melanoma may not exhibit this characteristic, advanced cases with significant necrosis are likely to present with this symptom. A thorough dermatological examination, including dermoscopy and biopsy, is necessary to confirm the presence of malignant melanocytes. Additional imaging studies, such as PET scans or MRI, may be warranted to assess the extent of metastasis, particularly if the odor is accompanied by other concerning signs such as lymph node enlargement or systemic symptoms. The underlying pathophysiology of odor development in melanoma is closely tied to metabolic alterations within cancer cells. Unlike normal cells, which rely primarily on oxidative phosphorylation for energy production, cancer cells exhibit a metabolic shift known as the Warburg effect. This phenomenon involves increased glycolysis even in the presence of oxygen, leading to the accumulation of acidic and fermentative byproducts. The acidic microenvironment within necrotic melanoma lesions further contributes to protein degradation and VOC release, intensifying the characteristic smell. From a therapeutic perspective, addressing the odor associated with necrotic melanoma lesions involves both local and systemic approaches. Topical treatments, such as metronidazole gel or silver sulfadiazine, may help reduce bacterial overgrowth and the production of odorous compounds. Additionally, advanced wound care techniques, including the use of hydrocolloid dressings and negative pressure wound therapy, can aid in managing ulcerated lesions. Systemic therapies, such as targeted treatments with BRAF inhibitors or immunotherapy with checkpoint inhibitors, aim to control tumor growth and, in some cases, induce regression of necrotic tissue. Palliative care plays a crucial role in managing patients with advanced melanoma, particularly those experiencing distressing symptoms such as malodor. Holistic approaches that incorporate symptom management, psychological support, and caregiver education are essential in improving patient well-being. In cases where melanoma has progressed to a terminal stage, hospice care teams often employ odor-neutralizing strategies, such as activated charcoal dressings or essential oil diffusion, to enhance patient comfort and dignity. The study of cancer-associated odors has gained traction in recent years, with emerging research focusing on the potential use of volatile organic compounds as non-invasive biomarkers for early cancer detection. Studies have demonstrated that trained scent detection dogs and electronic nose technology can identify cancer-specific VOC patterns with high sensitivity. While this field remains in its infancy, future advancements in olfactory-based diagnostics may offer new avenues for early melanoma screening and intervention. In summary, the presence of a rotting meat odor in melanoma patients serves as a stark indicator of advanced disease, primarily driven by necrotic tissue breakdown, microbial colonization, and metabolic alterations within the tumor microenvironment. The impact of this symptom extends beyond the physiological realm, affecting psychological well-being and social interactions. Early recognition and comprehensive management of odor-related concerns are essential in providing holistic care for individuals affected by malignant skin lesions. The ongoing exploration of cancer-specific olfactory signatures holds promise for improving diagnostic capabilities and patient outcomes in the future. 5. Sulfur or rotten egg odor, stomach cancer. Due to digestive issues, producing sulfur-containing gases with a distinct foul smell may be accompanied by bloating, stomach pain, loss of appetite, and gastrointestinal bleeding. Stomach cancer, or gastric cancer, is a malignancy that arises from the lining of the stomach. One of the lesser-known but significant symptoms associated with this condition is the presence of a sulfur or rotten egg odor emanating from the breath. This specific scent is primarily due to disruptions in the digestive process, leading to the excessive production of sulfur-containing gases, such as hydrogen sulfide. The presence of this odor can be an indicator of underlying gastrointestinal distress, often accompanying other symptoms such as bloating, stomach pain, loss of appetite, and gastrointestinal bleeding. The stomach plays a crucial role in digestion, breaking down food and facilitating nutrient absorption. Hydrochloric acid and digestive enzymes work in tandem to metabolize food, but when cancer disrupts the stomach's function, the normal digestive process is impaired. In cases of gastric cancer, tumor growth can obstruct the stomach's ability to empty properly, leading to the fermentation of food. This fermentation process results in the excessive production of hydrogen sulfide and other volatile sulfur compounds, which are then released as gas. Hydrogen sulfide, in particular, has a characteristic smell similar to rotten eggs, making it a distinctive marker of digestive dysfunction associated with stomach malignancies. Another contributing factor to the presence of a sulfurous odor in patients with stomach cancer is bacterial overgrowth. The stomach maintains a delicate balance of microbial flora, with certain bacteria aiding in digestion while others can become pathogenic under certain conditions. When gastric cancer is present, the stomach's acidity may be altered, creating an environment that favors the proliferation of sulfur-producing bacteria. Helicobacter pylori, a bacterium strongly associated with stomach cancer, is known to play a role in disrupting normal gastric function. Chronic infection with H. pylori leads to persistent inflammation, damage to the stomach lining, and an increased risk of malignant transformation. As the bacteria metabolize sulfur-containing amino acids, they release hydrogen sulfide gas, contributing to the foul breath odor commonly noted in affected individuals. Gastrointestinal bleeding is another hallmark symptom of advanced stomach cancer that can indirectly contribute to the production of malodorous gases. Bleeding occurs due to the erosion of blood vessels within the tumor, leading to the presence of partially digested blood in the stomach. As blood breaks down in an acidic environment, it produces a distinct metallic or putrid smell that can mix with existing sulfur compounds, further intensifying the offensive odor. In severe cases, gastrointestinal bleeding can lead to black, tarry stools melena, indicating significant blood loss and requiring immediate medical attention. In addition to digestive disturbances, stomach cancer often presents with symptoms such as persistent bloating and a feeling of fullness even after consuming small amounts of food. This sensation is commonly due to the physical obstruction created by tumor growth, which prevents the stomach from expanding and contracting properly. The resulting food retention exacerbates fermentation, leading to an increased release of sulfur gases. In some cases, patients may also experience nausea and vomiting, which further contributes to the unpleasant breath odor due to the regurgitation of partially digested food and acidic gastric contents. Weight loss is another concerning symptom that frequently accompanies stomach cancer. As the disease progresses, the body's ability to absorb nutrients diminishes, leading to unintended and often rapid weight loss. A decrease in appetite is also commonly observed, as patients may feel discomfort or pain when eating. The lack of proper digestion and metabolism can cause further disruption in the gastrointestinal tract, promoting additional bacterial activity and gas production. The presence of sulfur-containing compounds in the breath may be more pronounced in individuals who experience prolonged periods of fasting or malnutrition, as the breakdown of proteins and fats can produce similar sulfuric byproducts. Another important aspect to consider is the role of delayed gastric emptying, a condition known as gastroparesis, which may develop as a result of tumor growth. When the stomach is unable to empty its contents efficiently, food remains in the digestive tract longer than usual, leading to increased microbial activity and fermentation. This prolonged stagnation allows for the accumulation of volatile sulfur compounds, contributing to the persistent sulfur or rotten egg-like odor associated with stomach cancer. In some cases, patients may develop severe cases of gastroparesis, leading to complications such as bacterial overgrowth, malabsorption, and worsening nutritional deficiencies. The presence of a sulfuric breath odor in a patient with stomach cancer should prompt further diagnostic evaluation to confirm the underlying cause. Endoscopic examination is one of the most effective methods for assessing the stomach lining and identifying any malignant lesions. Additionally, imaging techniques such as computed tomography (CT) scans and magnetic resonance imaging (MRI) can provide detailed insights into tumor size, location, and potential metastasis. In some cases, breath analysis techniques are being explored as non-invasive diagnostic tools for detecting volatile organic compounds associated with gastric malignancies. It is also worth noting that certain dietary and lifestyle factors can exacerbate the production of sulfur-containing gases in individuals with stomach cancer. The consumption of high-protein foods, such as eggs, meat, and dairy products, can increase sulfur metabolite production, intensifying the unpleasant breath odor. Additionally, individuals who consume excessive amounts of processed foods or have diets rich in artificial additives may experience worsening digestive symptoms. Smoking and alcohol consumption further contribute to gastric irritation, increasing inflammation and worsening the symptoms associated with stomach cancer. Managing the symptoms of stomach cancer, including the sulfuric breath odor, requires a comprehensive approach. Treatment options may include surgical resection of the tumor, chemotherapy, and radiation therapy, depending on the stage and extent of the disease. In cases where surgical intervention is not possible, palliative care measures may be implemented to improve quality of life and manage symptoms effectively. Nutritional support, including specialized diets and supplementation, can help maintain adequate nutrient intake while minimizing digestive distress. For patients experiencing significant digestive discomfort, medications such as proton pump inhibitors (PPIs) and prokinetic agents may be prescribed to regulate stomach acid levels and enhance gastric motility. Antibiotic therapy may also be considered in cases of bacterial overgrowth or H. pylori infection to reduce the production of sulfuric gases. Additionally, maintaining proper oral hygiene can help alleviate some of the unpleasant breath odors, although it does not address the root cause of the issue. The presence of a persistent sulfur or rotten egg-like odor should not be overlooked, as it may serve as an early warning sign of underlying gastric pathology. While there are numerous benign causes of foul breath, such as dietary choices and transient digestive issues, the persistence of this symptom in conjunction with other concerning signs warrants medical evaluation. Early detection and intervention are crucial in improving prognosis and treatment outcomes for individuals diagnosed with stomach cancer. Understanding the physiological basis behind the production of sulfur-containing gases in the context of gastric malignancies can aid in the timely identification and management of this serious condition. As medical research continues to advance, novel diagnostic and therapeutic strategies may emerge to further enhance our ability to detect and treat stomach cancer effectively. These signs do not necessarily confirm cancer, but if unusual odors persist without a clear cause, seeking medical advice is recommended. Recognizing abnormal body odors can help detect cancer early, improving treatment success rates.